Hello, I'm Gabby Hoefer, and today I'll be talking about online social support and the COVID-19 pandemic. There's no denying that the COVID-19 pandemic has had a huge impact on our lives. With the rise of remote work and social distancing, the pandemic has limited our ability to interact with others in person and forced many to move online for work, education, and support. Meanwhile, studies have shown increased psychological stressors in response to the pandemic. Stay-at-home orders and social distancing have also been found to correlate with increased feelings of loneliness and decreased social support. Previous studies have shown conflicting results with regard to the relationship between online communication and feelings of loneliness and social support. The lack of in-person interactions by many during the pandemic provides us with an opportunity to understand how shifting to specifically seeking support online affects one's feelings of social support. In this paper, we look at dimensions of communication through the lens of two frameworks. First, we use the interpersonal connection behaviors framework and then the social compensation hypotheses to understand how various dimensions of interaction change social support dynamics during the pandemic. In this study, we ask 5 research questions, but for the sake of time, we will only be reporting on 2 in this presentation. Those questions being, what are the different effects on perceived social support and loneliness between public and private online platforms? And is self-disclosure of emotional state effective at cultivating positive social support when compared to time spent on online platforms? To investigate these questions, we gathered survey responses from over 800 college students at US-based institutions. Participants were recruited through emails, Reddit posts, and Facebook advertisements, garnering an average of 24 responses from students at 97 different universities. Demographic breakdowns can be seen in the displayed graphs. Recruitment was adjusted to include a diverse sample of participants based on university size. In the survey, participants were asked questions about demographics, the level of physical isolation, level of online interaction before and during the pandemic, and were asked to complete several measures of social support and loneliness. Using this data, we were able to extract trends in feelings of social support when related to online and in-person interaction patterns. In our results, we were able to validate previous findings about increased online platform usage and emotional self-disclosure during the pandemic. As shown in this graph, online platform usage increased across the board, and emotional self-disclosure frequency increased across all private methods of communication. Also, similar to previous work, we found that 64% of participants felt that the pandemic had a negative impact on their friendships. When considering the difference between public and private communication, we found that while students spent the most time using public social media as compared to private chats and calls, this was the only platform to show negative consequences with social support and loneliness. We also find that while both frequency of self-disclosure online and amount of in-person interaction correlate significantly with feelings of social support, frequency of self-disclosure online is even more strongly correlated than in-person interaction. Finally, we found that regardless of frequency of in-person interaction, additional online self-disclosure led to greater feelings of social support. Most prominently, we see that disclosing online daily showed similar levels of social support to interacting in person daily. As mentioned previously, we find a relationship between public social media use and increased feelings of loneliness. However, we also find a relationship between private online communication and decreased feelings of loneliness, as well as increased feelings of social support. This indicates that the relationship between online communication, loneliness, and social support is complex. When considering the interpersonal connection behaviors framework, this may imply that public social media consists primarily of passive interactions, which by the framework should have negative impacts, while private online communication consists primarily of active interactions, which by the framework should have positive impacts. We go into further discussion on why we may be encountering this pattern in our paper. We also find a relationship between the frequency of emotional self-disclosure and increased feelings of social support, particularly in one-on-one direct messaging conversations as compared to phone or video calls. This conflicts with previous hypotheses that people are more willing to disclose over platforms closer to in-person communication. We hypothesize that the privacy-preserving nature of private textual communication may contribute to user comfort and encourage disclosure. To summarize, we find evidence that online communication can act as a substitute for in-person interaction during periods of social isolation, such as during the COVID pandemic. In particular, we find that willingness and frequency of emotional self-disclosure over online platforms has a strong relationship with feelings of social support. We also find that public platforms show less promising trends than private platforms when looking at social support and loneliness. Thank you so much for listening, and please feel free to reach out or ask any questions at the conference.